let me talk something about some skills and some medical problems. Emergencies, stroke, heart attack, what's problems, big problems, like what?
BP.
Sugar, like what big problems, kill people, hypertension.
Sorry, 1 second. The first aid, according to Kuwait law, are we allowed to give CPR?
Why not?
There is no.
Yes. Just only introduce yourself. I am Adnan, I am first aider, I can give my help. Okay, you can. You know, nowadays there is a project here in Health Ministry to teach first aid and CPR for everyone. And a lot of complexes, there's make some training for CPR for public, for anyone who want to
For
train.
free.
For free.
Because I heard someone is unconscious.
So that's one. The government here encourage all the people to learn first aid for what? To save people.
Okay.
If you know what you do, I'm first aider. I can do the. If you have a license, you can show him your license. I don't know if the company give you license. I don't know for the.
Yeah, we looked for the license.
They give you license. Huh?
Yes, 2
maybe
years.
local from the company.
Yeah.
Yes.
B.
So there is license, different license. There's company license and there's license, international license. You can get license international from America. Okay, valid 2 years.
2 years.
Yes. Okay, to do CPR. Good. Now, a lot of conditions can kill people, but the killer number one, the most condition can kill people is what?
Brain heart attack.
Hmm? Heart attack. I mean condition as a disease. Heart attack. Heart attack kill people. Heart attack. Most of the cases die by heart attack. What is meaning heart attack? More than cancer?
Yeah.
More than all kind of cancer together.
Hmm.
Heart attack is the killer number one in the world.
Because it comes suddenly,
To strike.
without any sign or assumption. Yeah.
Heart attack. You see this heart? Okay, pumping the blood through the artery, where
The brain.
everywhere,
Hmm.
to supply with oxygen.
Hmm.
As the brain needs oxygen, all of your body, all cells and tissues need oxygen also. So the heart is pumping the blood for everywhere. Here and also coming down, as you see in the circulation here. Like that. The heart pumping to the brain and everywhere, and down for everywhere. Okay?
Hmm.
And the heart not to stop pumping all the time, even during your sleep. The heart working,
Yeah.
correct? Not to stop, because all of your tissue need oxygen. The brain, I told you, 6 to 10 minutes to die without oxygen. So must be the heart working, and working. Not to stop working. How it's work? There is a muscle. The muscle of the heart pumping. So the heart supply oxygen everywhere, correct? What about the heart itself? The muscle of the heart itself not need oxygen? Huh? Need oxygen? How it work? From where get the oxygen? From the heart himself. So he will supply himself before give everything for everywhere. So I told you this is the main artery to supply everywhere. So these small branches just to supply the muscle of the heart, to give the power for the muscle to contract correctly. Correct?
Okay.
If this artery blocked, big problem. So the muscle will not get oxygen, the muscle of the heart. So it will die. The muscle of the heart will die itself. Clear that point? So this artery is very important, small artery. Two main arteries and these branches. What's the name of this artery? Coronary artery. Coronary artery. We have right and left. You hear about this name? Coronary artery? شريان التاجي in Arabic. Okay? Coronary artery. There is a ward in the hospital, CCU, coronary care unit. Just ward. Because they are too much. Just only for this case. Coronary artery disease. Blocked. Block here. The branch, it will be, this is the normal coronary artery. This is, there is narrowing, completely blocked. This is the heart attack. There is a heart attack. Look here. This is the normal. Small blood. Bigger. And bigger. And bigger until blocked. Why this is blocked?
Smoking. Maybe the main reason.
Cake. Fatayr.
Also,
What?
Pizza. Cookies.
yeah.
MashaAllah.
Everything with too much oil.
Falafel.
Chicken?
What else?
Chicken.
Chocolate, no?
Kentucky.
That is the best.
You see? Plug. There's some shapes of blocking. So part of the heart is blocked. So becoming this is dead. How we pump very
Cannot.
Sometimes the problem is small. This is small problem. Because small area from the heart dead. Because the block here. What is the block here?
Big portion.
So all this area will dead. So the cases in heart attack, two types. 50% of them die directly. Die, خلاص. You cannot do anything. The person coming from outside to his family, they make a dinner, he eat, laughing with his kids, then he go to sleep. In the morning, not wake up. Suddenly.
He passed away.
And his wife still crying. He's not complaining from anything in his life.
Yeah.
Suddenly, no introduction. Like that. This is some of patients. Like that, we say this is silent attack. Silent attack meaning without any sign. He has to get from everything. Some cases no. During the attack, he feeling some signs. Pain, severe pain in the chest, sometimes go to the neck, short of breath, sweating, pale face, like that. So this is what we call 50%. This is, in this cases, we can, inshallah,
Save
survive him, but maybe also die. Why? Why does this happen too much everywhere? Why is the killer number one? Why is spreading everywhere in
The
the
lifestyle
world?
is not healthy.
Huh?
Our lifestyle not healthy.
Yeah. This
10
is
factors.
the reasons.
We have 10 factors.
Mhm.
Smoking,
The main reason.
high cholesterol. What mean high cholesterol?
Too much
Artificial meat.
sweet.
Artificial meat. Pepperoni, mozzarella, hot dogs. All of that. This is not meat. Don't tell you this is meat. Be careful, huh? Yes. Cheese.
Also, huh?
90% of cheese in the Jamia is not cheese.
What?
Especially in the glass. Okay? Look nowadays there's a rule. They put something word, this is vegetables cheese. or cooked by vegetable way. How? Cheese and vegetable. How?
Really, how?
Huh?
How? Really?
Vegetable coming from the cow,
Big lie.
not from the planet. Correct? So like that. So this is most of them is, especially the liquid cheese. Some doctor said you can say this is anything. Say this apple. Say this orange. Say this banana. But don't say this cheese. It's not cheese. Okay, good. Only this one, no. Anything fried with oil, especially outside your home. Okay? And we can provide potato in the home. It's okay. Accept it. But outside home, no.
The
No,
quality
very
of the
different.
oil.
In your home, you are use good oil.
And the frozen potato.
Okay, you know it. Okay.
Fresh.
And you use it 1 time, 2 times, and throw it
Yeah.
for a small amount.
At
and
least
throw it,
3 times.
correct? But outside the restaurant,
Maybe 10 times.
they tons of
Yeah.
potatoes
Or more.
for all the city eating in 1 day from this oil.
And it became until it became black, the oil. Yeah.
Burning it. And hey, this is falafel. You know falafel? Terrible. And we eating dishes.
Yeah.
Some people eat it daily. Falafel in the morning, pizza for lunch, and dinner, fried chicken. Family history. My father died from heart attack. My brother also, he has a big operation in his chest. My cousin also, he has a problem in the coronary artery. Another one, uncle, also same. What's that meaning? You are the next. You are the next. All of that from your family, you are after them, inshallah. But be careful. Diabetes. I diabetic. Obesity. I have hypertension. What I do? Stress. A problem with my boss. A problem with my wife. With my neighbors. In the street, shouting to this man and this man. Lack of exercise. Only in the home watching TV.
Connect.
Aging. How many points? 1? 9 points. You can add a 10th point. What would you call atherosclerosis? It's a disease, atherosclerosis. And this is coming from smoking. 10 points. If you have from this point 5, 6 points, be careful. Clear? Yes. All of that I can manage and save myself. How? Only 2 points, you cannot do it. Anything? Family history? Aging. Your age. We can say يعني, maximum more than 40, be careful. Okay? And in this, most of the patients nowadays, more than 40 years. Before 20 years in the past, when I was in the college, we said above 50.
Yeah.
Okay? But nowadays, most of them above 40. And some cases in 30
Yes.
and 20. Some people, but this is very little. Okay?
Obesity.
Before, we can say coming for the men more than women. Nowadays, same. You know, this time for equality for the women.
In everything.
Yes. Okay, good. Otherwise, you can manage. You can stop smoking. You can watch what you eat and make test every 6 months. Make a test for your blood to see could you have cholesterol or not. Because the cholesterol not clear in your face, must be tested. Obesity, make a diet. Make a program to yourself. high blood pressure and diabetes is a disease. Happens with everyone. But you can manage it and you can follow the instructions of doctor and take your medicine in time. You will be okay. Exercise. Minimum must be walking half hour daily. Stress.
You cannot
This is
avoid.
your mood. No, you can. You can. This is your decision.
In-
Stress, your decision, not the others. You can leave it. Don't think everything. If you want to think it life nowadays, you will die. All of us has a problem. Nobody without any stress. Everything, every day. And it's not in your work, in your family, with the others, in the street.
It surrounds you.
Around you, yes. Not affect you. Leave it. Okay? What I do for these patients, if they are not die and you are with him, these are the basic points. ABC, remember ABC, and if you collapse, becoming not responding, start CpR. Complete rest is essential, very important. Let him to sit in the chair, arrest him, quiet him, reassure him. Okay, don't worry, inshallah it's okay. Now I will call the ambulance, they will come in. No, I'm okay. No, I know you are okay, I know, but this is made for you some test like that. Try to reassure them, to relax, smile with them. Good words, very nice for him. Because in this case, very important, the stress, if you're thinking sometimes he's thinking he will die. So give him some small words, very nice word, like that. Be smart in this case, okay? Don't come to the patient like that. You have been here? Adnan told us in the course he's heart attack and he will die. You must call for him. It's not like that, okay? Paramedics in the ambulance, they are not, they will off the ceiling, not open it. Because we want to give messages to the patient, you are okay. It's very important. Aspirin. Aspirin can save his life. Aspirin can save his life. You know aspirin?
Yeah.
Huh?
Yeah.
Same Panadol or different?
Different.
Different Panadol. Some people think aspirin is same Panadol. No.
No, they are different.
Aspirin.
But
Aspirin. Very cheap. Half the Okay? There's two types of aspirin.
generic.
Two types of aspirin.
300.
Large dose, small dose. See? 80 milligram, 81, 100 milligram, 120. All of that is low dose.
300.
300, large dose, big dose. Okay? So for big dose, give 1 tablet. For low dose, give 2 tablets. This one, 100 is what? Low dose.
Low.
You give how many?
2.
2. But be careful. Be careful. You must ask him 2 questions.
Yeah. May I
You have
have?
allergy?
Yeah.
You have allergy from aspirin or not? If you have allergy, don't give him. And also,
Stomach.
ask him, you have any bleeding recently happened with you? Like what? Like peptic ulcer in the abdomen, like stroke in the brain. If you have history recently from the bleeding, don't give him. Clear? Yes. Doctor, who will decide to give you a small dose of aspirin daily to prevent heart attack in the future? It's okay, but doctor will decide that. He will see. You remember the 10 rules, 10 factors? Okay? So the doctor, he will see for this patient. He has a lot of factors from these rules. He will give you this aspirin. And you are 45 years old and you are complaining from blood pressure, hypertension and diabetes, and you are coming to me in the clinic. So and you have hypertension and you are more than 40 years and diabetes and you are obese. In the test you are has high cholesterol. So I will not wait until you bring to me with heart attack. So I will give you small amount, like 80%, 80 milligram of aspirin. Take it daily.
Okay.
It's happen.
Yeah.
But not from your own time. No, not like that. If you are okay, no need for aspirin. So not good. Not all the time is good. To prevent attack for some patients. Okay? Depend. Inshallah. Heart attack.
So, if we could just maintain the momentum we've had so far, looks like we need to keep up our profits over the summer. Well, why don't we add a new product line now when it's slow, and then we could increase production in the fall? No, not such a good idea. If I could just try, tell you, George,
Suddenly,
what's
just
going on? You
pain,
keep rubbing your chest. Oh,
big face,
I don't feel so good.
cannot speak very well, and you
It's no
breathe too
problem.
much.
Listen,
Short of breath.
George, I'm trained in first aid. Can I help?
Ask him.
Many people with an
Could you
uncomfortable
use your
feeling in the
therapist?
chest don't want to believe that it could be a heart attack. If someone has signs of a possible heart attack, you must act and phone 911 right away, even if the person doesn't want you to. The first minutes of a heart attack are the most important. That's when a person is likely to get worse or even die. Also, many of the treatments for heart attack will be most successful if they are given quickly.
Yeah, I guess so. Okay, tell me what's wrong. My chest feels tight. It feels like something is squeezing it.
Squeezing.
Oh.
Sometimes like a compression. He feel like a big stone over his chest. Sometimes he said like that. I feel a stone over my chest. Okay? Compression, pressure, squeezing.
Oh. I'm starting to feel sick to my stomach. I can just
Sometimes feel something in the stomach. Also this is a sign.
sit down for a minute.
Sit down.
Fine. Alicia, phone 911. Tell them we have someone with tightness in their chest.
Got it.
And Joe, could you get the first aid kit and the AED? They're in the break room.
Yes, there's a man here. He's having tightness in the chest. He's sweating a lot and he's nauseated.
No, wait. It's just a little heartburn.
He just want to leave that he has heart attack.
Listen, George, do you have any allergies to that?
He asked him, you have any allergies to aspirin?
No.
No.
Have you had any bleeding lately?
Any bleeding?
Have you ever had a
I have
stroke?
stroke.
No, neither.
Yes, it's 8200 Bell Street.
George, I'm going to give you one adult dose aspirin. Chew that up and swallow it. Okay.
We've just given him one adult dose aspirin.
Okay. Thanks.
Paramedics are on the way.
When you take this aspirin, you can show it, then swallow with comfort. Okay, that's better.
Main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort
Is the
in the
main
center of the
sign,
chest that lasts
chest
more than a
pain?
few minutes.
It's going
When it
everywhere
goes
in
away
the
and
chest,
comes
upper
back.
chest.
It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness.
Nausea. Nausea meaning feeling to vomit. Okay, sometimes he vomit also.
But what about the difference between
Sweating. If you touch his head, you find this very cold. And it's a sign.
a heart attack and cardiac?
This you know this one. Okay. Another case. Okay. Allergy. You know allergy? Yes, chocolates. Allergy.
Allergies are quite common, but if severe, an allergic reaction can quickly turn into a medical emergency.
Allergy, I think a lot of people has allergy. Maybe one of you has allergy. Allergy from anything.
Fruits.
Something from food, weather, allergy from
Fish,
dust,
yeah.
from animals, fish, eggs, all that, correct?
Yeah.
About me, what happened with me, sometime when there is dust, directly I was sneezing, sneezing and something itching inside my nose, red eyes, sometimes runny nose also. So like that, I will go to the clinic, give me a small tablet in the night. You know what the name of this one?
Cerestamine.
It's very common.
Cerestamine.
Zyrtec, allergy, Beriton. A lot.
Cerestamine also.
Correct?
Yeah.
2-3 days, becoming okay. Some people has a rash, red colors in some areas. This is allergy. This is killing? No, it's not killing. Okay? This is what we call simple, mild. But there is some kind of allergy can kill. Okay? The science not like that. No. Red face, swelling tongue, cannot breathe, swollen eyes, legs swelling, inside the airway blocked, coming not responding, not breathing, then he will die. All of that in few minutes. So this is a big problem. This is what we call allergic reaction or severe